welcome to this presentation with me, Cindy, at Kika and Niso on YouTube channel. So before we go into our lesson for today, I would like to air out my sincere apologies to you guys for not posting the lessons on the platform. This is because I have been working on most of your requests. So most of you said that you needed the notes. So I've been working on that and also learning how to create and edit videos. I've also been working on that. So that has been the reason of me not really being active on YouTube. So welcome back. So we are continuing with our lesson we started on malaria, and in this lesson we are going to look at the complete topic. Then in the next topic we'll look at the specific medical management for malaria, though we'll talk about it briefly in this presentation. I will create another lesson on specifically the drugs that we are using for management of severe malaria in the nursing management of a patient with severe malaria. So now let's look at our presentation. So we are looking at malaria. So our general objective is that at the end of this lesson, the student should be able to acquire knowledge about malaria and should be able to nurse a patient with malaria. So on the specific objective, you should note that you should be able to define what malaria is, state the causes of malaria. You should be able to know the species that cause malaria, how it is transmitted. You should also be able to describe the life cycle of a malaria parasite. You should be able to explain the pathophysiology of malaria, and you should be able to state the signs and symptoms of malaria, and you should be able to explain the medical management, which includes investigations and the medication used for treatment of malaria. So those are the specific objectives of our lesson this afternoon. So let's look at the introduction. So malaria is a major public health problem in Zambia. It is endemic throughout the country and it is responsible for more than 40% of outpatient care and 37% of admission facilities. This was according to the Ministry of Health report in 2010. Then malaria contributes to 20% of the total number of patients death. That was according to the Ministry of Health 2010, and 40% of infants and 20% of maternal mortality rates. So it is also, you should also remember that in the previous videos we looked at the introduction. So I'm just running through them as fast as possible because we already looked at them. So in 2019, Plasmodium falciparum accounted for 99.7% of estimated malaria cases in the World Health Organization African region, and 50% of cases in the East-West Asia region, and 71% of malaria was in Eastern Mediterranean, and 65% in the Western Pacific. That was according to the World Health Organization report, November 2019. So these statistics shows us that malaria is not only in Zambia, but is endemic in most parts of the world as listed above. So now let's move on to the risk factors. So what are the risk factors? Who are the people who are at risk of having malaria? Well, in Zambia, everyone is at risk of being infected with malaria. However, children under the age of 5, pregnant women, and immunosuppressed persons are more they are more at risk of having malaria. This is due to the reasons that we are going to look at. So also people coming from non-malaria areas, people like the tourists or people who travel to countries where there is no malaria, these are also at risk of having malaria because they do not have the acquired immunity. So on this picture, we are able to see how a mosquito is beating an individual. So what it's doing is just that it's injecting the sporozoites in a person's body while it's sucking out the blood. It may also mean that it's sucking out the gametocytes of the parasites. So let's continue looking at the risk factors. So more information on the risk factors. When it comes to children at a high risk of getting malaria due to lack of exposure to parasite infection. These children suffer high parasite densities and acute clinical disease. If not treated, it will rapidly progress to severe malaria. So this simply means that children are more at risk of having malaria because they are not exposed to the parasites yet as compared to us, the adults. So these, you find that even the number of parasites, they'll have a lot of parasites in their blood when it's examined, when their blood is examined under the microscope. It is because they lack the acquired immunity for malaria. So when it comes to pregnant women, they are more at risk because of their suppressed immunity. And studies have shown that throughout the region, pregnant women have a significant level of parastemia. So usually, also the studies shows that most pregnant women have got at least a higher level of parasites in the blood. So those are women who have got malaria. So when it comes to prime gravid, so these are pregnant women who are pregnant for the first time. So those who are pregnant for the first time are also at risk of having malaria because their immune system is suppressed, and also it becomes worse in pregnant women who are HIV positive because their immunity is already suppressed by the virus. Then the pregnancy also suppresses further their immunity. So they are more at risk of developing even severe malaria. So pregnant women are more at risk because they have suppressed immunity. And okay, so we just looked at this. We've talked about this point. So for the prime gravid, it can also result for the prime gravid and for those who are HIV positive mothers, malaria can lead to anemia in pregnancy. It can also cause stillbirth. This is giving birth to a baby which has died. Then it can also cause hemorrhage in pregnant. This is bleeding in pregnant. So it can also lead to abortion or premature delivery. It can also contribute to low birth weight, which is directly linked to infant mortality. So this is how dangerous malaria is in pregnancy. So let's move on now. Let's look at the definition of malaria. So remember that we are just from talking about the risk factors and we have explained and stated them. So now let's look at the definition of malaria. How can you define malaria in case it comes in the exam? So you need to define malaria in the way that you should be able to get the 5 marks that they require. So we can define malaria as a parasitic infection that is caused by the protozoa of the genus Plasmodium, which is transmitted through a bite from Anopheles female mosquito. It affects multiple organs such as blood, the brain, the gastrointestinal tract, and it is characterized by fever, joint pain, abdominal discomfort, and convulsions when it comes to severe malaria. So when it comes to defining malaria, always remember that you need to state what type of an infection it is. It is caused by parasites. Which parasites? The plasmodium, the plasmodium species, and it is transmitted. You need to mention how it is transmitted. Then you need to state which organs are affected, and then you need to list at least 2 or 3 signs and symptoms. So that's where you're making sure that you are putting in the information that they need. So that's how we can define malaria. So now let's look at some details on the species, some details of the species that cause malaria. So there are 4 main species of parasites that infect humans, and these are the Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale. So note that the most common one in Zambia is the Plasmodium falciparum, and this is the one that we usually screen for because it accounts for about 95% of all malaria cases that we have in Zambia. So the most common one in Zambia is falciparum, which accounts for 95% of all malaria cases. So Plasmodium malariae comprising of 3%, and Plasmodium ovale at 2%, and Plasmodium vivax is very much rare in Zambia. So let's also look at the vectors. The 3 main vectors which have been identified. These are Anopheles fenestus, Anopheles gambiae, and Anopheles alebiasis. So these are the 3 vectors that are associated with the types of Anopheles which cause malaria. So sometimes they can ask you to say, state or name the vectors which are involved, which have been identified. So you should be able, when you just hear vectors, they are talking about these 3: Anopheles fenestus, Anopheles gambiae, and Anopheles alebiasis. So these are the vectors. So now let's go on to look at the transmission. So malaria transmission can be classified as stable or non-stable transmission. So when it comes to stable transmission, stable transmission occurs in areas of stable transmission. Malaria is frequently transmitted by mosquitoes from one person to another, resulting in high levels of acquired immunity and low peripheral parastemia. So this simply means that in stable transmission, there are a lot of malaria cases, and so malaria is easily transmitted from one person to another, and as a result, these people develop an acquired immunity. As a result, they even have a lower peripheral parastemia because they have an acquired immunity because of the frequency of malaria cases happening in those areas. So that is what we call stable transmission. Then when it comes to unstable transmission, in unstable transmission, malaria infrequently transmitted by mosquitoes from one person to the other. So it simply means that malaria is rarely transmitted from one person to another. So in these areas, there are not a lot of cases of malaria. So as a result, people do not develop an acquired immunity of the malaria. So as a result, because they don't have an acquired immunity, they will tend to have a heavy peripheral parastemia, and these areas are prone to endemic. So notice that in unstable transmission, people do not have acquired immunity, and that causes them to have a high levels of parasites. So how do we know that this person has got this number of parasites? It's by doing collecting blood for malaria parasites, smear. So when it's taken to the laboratory, they are able to count how many parasites the individual has. So in unstable transmission, we notice, we know we've uh, these people, these patients from these areas will tend to have a high or heavy number of parasites. So that's the difference between unstable transmission and stable transmission. So now let's go on to look at the malaria, the life cycle of a malaria parasite. So it is important to know that malaria, the life cycle of malaria parasite takes place in two hosts. That is in the human host and in the mosquito. So in the human host, the parasites produce asexually. So they multiply asexually. While in the mosquito, that's where the parasites produce sexually. So as we can see from this diagram, it is showing us how the malaria parasite is transmitted. So let's now look at what happens specifically. So in the first stage, so during the first stage of a malaria parasite, a female mosquito that has already fed on the blood on an infected person bites another person and injects the sporozoites which are found in its saliva. So in the first stage of the life cycle, a malaria which is simply infected, so it has parasites within it, it will bite a person who is not infected. So as it bites that person, it will inject or it will introduce sporozoites in the person's body. So that's in stage 1. Then in stage 2, it is also called the liver stage. So during the liver stage, the sporozoites will go to the liver and infect the liver cells. And they will transform or they will develop into chizoids that produce asexually to generate large numbers of merozoites. So the parasites have developed into the chizoids, which are produced asexually to generate large numbers of merozoites. So the sporozoites have now undergone a further development to the stage where they have become merozoites. So that occurs in the liver. So as we can see from this picture, this liver is infected with the malaria parasites. So the sporozoites came in this liver, then invaded the hepatocytes, which are cells of the liver, and then they underwent development to chizoids. Then chizoids produced asexually to produce the merozoites. So this happens during the liver stage, as we are able to see. So now let's move on. So it is important to notice that during the liver stage, at this stage, Plasmodium vivax and ovale may become dormant. So when they become dormant, it simply means that the person will not show the signs of infection. It may even take maybe months, weeks, or even years for a person to show signs of infection. So they will become dormant. Then after some time, a person will have a relapse. A person now will become sick of the malaria that you are talking about. So it is important to remember that. So when it comes to stage 3, after 3 to 30 days, the merozoids rupture the liver cells and begin the erythrocytic cycle, also known as the red blood cell cycle. So stage 3, the merozoids have ruptured the liver cells, and then they go into the bloodstream and start the erythrocytic cycle, which is also called the red blood cycle. So during the cycle, the merozoites invade the red blood cells in the peripheral bloodstream, where they feed and multiply further. So the merozoites enter the circulation in the peripheral system, and then they start to feed and rupture the red blood cells. And this is what we can see on this picture. This is a normal cell, and these cells are the ones which are infected with the parasites. As you can see, these are parasites inside the cell. So these parasites will start feeding on the hemoglobin, destroying the red blood cells, and this is what will cause anemia when it comes to severe malaria. So this is what happens. The parasites, the merozoids, invade the red blood cells, start feeding on them and destroying them, as we can see. So all this is happening in the third stage. So this results into a large increase of parasite population in the host. The release of merozoids produced a characteristic fever in a patient. So the merozoites are now feeding on the red blood cells. They're also multiplying. As a result, a person will now have a lot of parasites circulating in their body, and as a result, a person will start now showing signs and symptoms of malaria, such as fever. So when it comes to stage 4 and 5, after the asexual cycle, some merozoids develop into gametocytes, the asexual form, which are ingested by a mosquito by sucking the blood. So during the 4th and 5th, we see that the merozoids have now started to produce asexually. So they even develop into sexual cells, the gametocytes. So this is where others become females, others become males. So this is happening in the peripheral system. It is happening in the liver, and these are the gametocytes which are going to be sucked in by another mosquito, will be biting that person who is infected with malaria. So when it comes to stage 6, the mosquito that bites this person who has these parasites in this body, the mosquito will suck that blood which contains the gametocytes. So these are the female and male parasites. So the male and female parasites gametes emerge from the gametocytes and fuse into a zygote, which migrates into the gut wall, where they produce the oocytes, then generates approximately about 1,000 sporozoids. So the 6th stage is happening in the mosquito. So this is the mosquito who had fed on the person who is infected with malaria. So by feeding on the blood which is infected, so the blood contains the gametocytes. Those are the female and the male gametocytes of the mosquito. When the mosquito sucks in, so in the mosquito gut, the male and the female will fuse in so that they'll produce sexually. So they'll produce sexually and generate oocytes, which will produce about 1,000 sporozoids. So they produce sexually and produce the sporozoids. Remember that those are the sporozoids which are now going to be injected into a person who is not infected by a mosquito biting the person who is not infected. So after 2 weeks, the sporozoites migrate into the mosquito salivary glands, becoming highly infective after 9 days, and the cycle starts. So what we are saying is, the mosquito which was not infected initially has bitten a person who is infected with malaria. So as the mosquito is feeding on the blood of that infected person, it has taken up the gametocytes for the mosquitoes. Those are the female and the males. So when it sucks in those parasites, they go in the mosquito gut, where they meet now sexually to produce the sporozoites. Now after some time, after 2 weeks, those the sporozoites will now migrate from the mosquito gut, from the mosquito GIT into the salivary gland. This simply means that those sporozoites are now mature and are ready to infect someone. So this mosquito will now be able to transmit the sporozoites to cause malaria when it beats someone who is not infected, and the cycle starts. So this is the life cycle of a malaria parasite. I hope that is loud and clear. So let's now move on to look at the pathophysiology of malaria. So the pathophysiology of malaria results from the destruction of erythrocytes, the reparation of parasites, and the erythrocytic material in the circulation, and the host's reaction to these events. This point simply means that the pathophysiology of malaria comes about because of the destruction of the red blood cells. Remember, we said that the melozoites from the liver will infect the blood cells in the peripherals. So as they invade, they'll start feeding on the red blood cells and destroying them. So as they are destroying them, they are also releasing materials of the red blood cells in the circulation. So as they are releasing those materials into the circulation, the body immunity now will react to this event. The body now will be alert to say there is an infection going on, so we need to fight it. So that's how the pathophysiology of malaria comes about. So the incubation period of malaria varies generally between 6 and 30 days, except for Plasmodium malariae, which lasts for 2 weeks. So now let's continue with the pathophysiology. So in Plasmodium falciparum malaria, red blood cells that contain the schizoids adhere to the lining of the capillaries in the brain, the kidneys, the gut, that's the GIT, the liver, and the other organs. So what this point is saying that those blood cells which contains the schizoids, these are the parasites, because they will be heavy because the parasites have invaded on them. The parasites have entered in them. So they'll become so heavy that they won't move the way they are supposed to move in the blood vessels. As a result, they are going to adhere to the lining of the blood vessels. So this will cause mechanical obstruction. It's like they will obstruct the normal flow of blood in the blood capillaries. So apart from causing mechanical obstruction, these schizoids will rupture, releasing toxins and stimulating further cytokine release. So cytokines, these are simply the inflammatory chemicals which are released because of what is happening. So inflammation is also taking place. So the mechanical obstruction to blood capillaries causes impairment and widespread of damage to vital organs due to impaired microcirculation. So as we are seeing, in the blood vessels, in the blood capillaries, where these red blood cells are, which are containing the parasites in them, they are so heavy that they are not moving properly. As a result, they have caused impaired circulation. So blood is not moving accordingly, and we know that when blood is not being supplied the way it's supplied, the way it's supposed to be supplied, that's another problem. It means the body organs, the body cells won't be receiving adequate oxygen and nutrients that it needs. So that's another problem. So apart from causing mechanical obstruction, these chisons rupture, releasing toxins and stimulating further cytokine release. So inflammation continues to occur because of what the events that we are talking about. So there is even impaired blood circulation. There is release of toxins by the chisons. So the mechanical obstruction to the blood capillaries causes impairment, widespread damage to the vital organs due to impaired microcirculation. So imagine that impairment is occurring in the brain. It means the brain cells are not receiving adequate oxygenation and nutrition and all those things that the blood supplies. So it will result into change of behavior. So when we talk about severe malaria, we see that these patients, they are going to have change in behavior when they have cerebral malaria. So this is when the parasites, they're gone in the brain and they are just behaving the way they are behaving. So a person will have change in behavior because the brain cells are not receiving adequate nutrition and oxygenation. So when it comes to the kidney, it's the same thing. The parasites have entered those red blood cells. Those blood cells are heavy, they are not moving the way they're supposed to move. There's mechanical obstruction, and so the kidney cells, they are not receiving adequate blood and oxygen that they need. So we'll find that the patient will even develop acute renal failure, which will be evidenced by black water fever. So this is it is because of what is happening. There is damage to vital organs due to impaired microcirculation. So this is what happens. So the cytokines are involved in placental dysfunction, suppression of erythropoiesis, inhibition of glycogenesis, and causing fever. So these cytokines, when it comes to pregnant women, so when the pregnant woman has got malaria, so those parasites will go to the placenta and there will be placental dysfunction. Also, it will reduce on the production of the red blood cells. That's why anemia will come about. And then there's also inhibition of glycogenesis. This may result into a person having hypoglycemia and causing fever. So a patient will present with having fevers, convulsions. All those things will come about due to what is happening, the release of the cytokines and the body reaction to the infection. So the repeated infection of red blood cells by merozoites leads to anemia, chills, and fevers. So this is the pathophysiology of malaria. I hope that was clear enough. If it was not clear, you can always ask a question. So this is what we are talking about. These red blood cells, these here are the ones which are infected by the malaria parasite, as we can see the parasites, they are in these red blood cells, and they can't move because they are heavy, and if they cannot move, they adhere themselves to the lining of the blood vessels, which will cause mechanical obstruction. And when there is mechanical obstruction, there is release of the cytokines because the body cells are not receiving adequate oxygenation and nutrition, so inflammation will start to occur. This is because this is what is happening. So now let's move on to the signs and symptoms. So malaria can be classified as either complicated or complicated malaria. So under uncomplicated malaria, the signs and symptoms are as follows. So a patient will present with fever, which is above 37.5 degrees Celsius. They also have headache. They'll have sweats and chills. They have body pains and acute gastroenteritis. So this is in uncomplicated malaria. So in moderate malaria, we see that the infection is now advancing. There is now nausea and vomiting due to the involvement of the GIT. There is also dehydration and diarrhea, and also extreme weakness. So because there is gastroenteritis, there is inflammation of the GIT there, a child or a patient will have some diarrhea, which will result in dehydration, vomiting, and nausea. And because of these things, the child or the patient will be extremely weak. And then when it comes to severe malaria, in severe malaria, we will see now severe anemia. So severe anemia is coming from what we are just from talking about, the destruction of the red blood cells. So this will also cause jaundice, shock, convulsions. Convulsion will come about due to the involvement of the brain. Then there is also respiratory distress. So the patient will have now difficulties in breathing. So when it comes to severe and complicated malaria, this is where now we'll see the patient being unconscious now. There is also change in behavior. There is also a high number, a heavy density of parasites in their blood. Then there is also prostration. So this is generalized weakness, and the patient is unable to stand or walk. Then there is also abnormal bleeding. So those are the signs and symptoms of malaria according to severity. We've looked at uncomplicated malaria, moderate malaria, and severe malaria. So now how can we diagnose, how can we manage a patient with malaria? So the first one, the clinical diagnosis, this is usually done in rural areas where there are no laboratory facilities, and malaria has to be diagnosed clinically. So during this time, the clinician or the nurse on duty will have to get a detailed medical history from the patient, and then it should show the common signs and symptoms of malaria and how the disease started. So if you are writing in an exam, you can say a detailed medical history will review the signs and symptoms or the risk factors of a patient having malaria, maybe such as a patient is coming from an endemic area, or maybe they are children under the age of 5. Those are the ones who are prone at having malaria. So make sure you get a detailed medical history because it can help you make a diagnosis of malaria. So the other test which can be done is a malaria parasite smear test, which is an MPS. So this is done in a facility where there is a laboratory. So a thick or thin smear will be taken from the patient and taken to the laboratory where they were able to examine it. It is useful for confirmation of malaria and differentiating the species. Also helps to know the number or densities of parasites. So this is the confirmatory test which is going to be done, and it will confirm that this patient has got this type of malaria and how many parasites they have. Then the third one is the the rapid diagnostic test, which is the RDT. So these are also available in clinics in rural areas, some rural areas. So it is a serological test that gives the result within 10 to 15 minutes. So this one can also show if a patient has got malaria or not. So in the next lesson, we'll look at how we can perform an RDT and how to collect an MPS, the malaria parasite smear test. So we will do that. So when it comes to the treatment, then also remember that during the investigation, we also want to do a full blood count because we want to rule out anemia. Because patients with severe malaria, they will usually have a low hemoglobin level because of the parasites feeding and destroying the red blood cells. So it is important to always do a full blood count to rule out anemia. So when it comes to the treatment of malaria, the first line, so in the other lesson, I've also made specifically for management, treatment of malaria. We will look at the medication in details. So in the first line, we have the antimetal lumefantrine, which is Coartem, which we are familiar with. Then we also have Fancida, which is sulfadoxine parafenamide, which is Fancida. It is used for treatment of malaria in children less than 5 kg. So those with 5 kg and above, we give Coartem in the first line. So this is uncomplicated malaria or moderate malaria. So when it comes to the second line, which is severe malaria, we are currently using artesunate for the management of severe malaria. It can be administered intravenously or intramuscularly. Then if it's not available, we can use quinine, which can be given intramuscularly or intravenously or orally. So I have prepared a separate lesson on the treatment of malaria. You should be able to see it very soon. Then here is just an example of how we are going to nurse the patient. So I've just identified one problem as for now. So this is just how you can write your nursing care for a patient with malaria, and the problem that we identified was fever, which is altered thermoregulation. So this is just how to is showing you how you can write your nursing care. So in the next lesson, we'll also look at the specific nursing care that you are going to give a patient with malaria. As a nurse, we want to make sure that we are giving specific nursing, quality nursing care to our patient. And so this is the end of the presentation. I hope that it was clear. So if you've not understood, you can send in your questions and your contribution. So thank you very much. Have a good day and all the best as you are preparing for your exams. Bye.